Patient 8 is 50-year-old land inspector of the Ministry of Natural Resources, Ramsey Gillett, who is attached to the Corozal branch of the Lands Department. Gillett lives in Paraíso with his wife and 2 children. He is the second person to test positive in that district in 4 days. On Saturday, a student was the 5th confirmed case overall for the country, and the patient remains in quarantine.
A well-known gentleman within the town, and I believe within the whole country, as we all know, he's a very respectable guy and a very friendly guy. It's really an unfortunate situation for him, his family, and for Corozal Town. But it just shows that this virus has no respect for anyone.
In a social media post by his sister on his behalf, Gillett preferred his personal advice in respect of the health system and called for understanding to wipe away the stigma associated with COVID-19 patients. It says, quote, "Please afford prompt and courteous service to all who make an outreach and attempt to engage the public health services. My experience could have been different," unquote. He accessed the private medical facility in that northern municipality on Saturday, complaining of fevers and headaches. He was checked and referred to the Corozal Community Hospital, but we are told he was denied testing because he did not qualify. His condition did not improve, and he returned to the private facility. He was again provided with antibiotics and referred to the community hospital, and after some calls were made by relatives, Gillett was finally swabbed and admitted to the public hospital on Tuesday. By 7 o'clock this morning, it was confirmed that he had contracted COVID-19.
In terms of the patient we detected yesterday, it's a 50-year-old male. He has one precondition. He's a diabetic. He was swabbed. He doesn't really have respiratory symptoms now, but he did refer having had respiratory symptoms, being seen at a private facility, being treated with antibiotics in a private facility. So when he came into the health system, it's because he was having minor respiratory symptoms, but primarily abdominal pain and diarrhea.
But is patient 8 an imported case? Gillett says that he had not traveled recently, but believes that his line of work may have made him exposed. So if it is that he didn't travel recently or come in contact with another confirmed case, is it then a community spread? Did he pick up COVID-19 from someone within the community who does not know that he or she is infected?
He doesn't have a travel history that much we know, other than being across the border, but no travel history to the U.S. So we'll have to determine in the mapping exercise where he could have potentially become infected, and that exercise started very early today.
I would have to allow the Ministry of Health to do its mapping so that we all know and are very aware of where he got infected from. No, I don't believe it's from Corozal Town, but it's all up to the mapping that the Ministry of Health will do.
At this time, the prognosis is good for Gillett, who remains hospitalized in a stable condition.
The patient is stable. I just checked before I came on. He's with no respiratory symptoms. He's without any oxygen, and he is saturating at 96% without any supplementary oxygen, with no respiratory condition at this point in time. So that patient is being managed at the Corozal Community Hospital in the isolation area, away from the routine Corozal Community Hospital patient set.
Corozal Mayor Rigoberto Veo says that going forward, the contingency plan remains intact with further enforcement.
It's up to us now to defend our brothers and sisters out there. No? This is the time when we need to respect the curfew more than ever, and we need to work together with the police department and the leaders and officials who are working to make sure that this country stays free from this virus as much as possible.
Duane, Moody for News 5.